Hey everyone, good afternoon. County Executive Pat Ryan here. Thanks for joining us. We have lots of information to cover. We'll try to do it concisely and quickly. Almost all of it is very good news and good progress, so that's a nice way to start the update. We're really making good headway on bringing down COVID numbers, bringing up vaccination numbers. We have one initiative to announce today that I'm really excited about. But we also have a lot more work to do, so continue to ask everybody to keep pushing, especially in getting our vaccination numbers up. But we'll start with the numbers, as always. I want to start with one number that's an important milestone, which is this is actually our 100th press briefing since the beginning of the pandemic, which is kind of hard to believe that we've now done 100 of these. Starting in March of last year through all of the phases of this, from the very first cases to testing sites and reopening and now vaccinations and all the recovery work. It's been an unexpected pleasure to get to share these updates with all of you and to people that have been tuning in and watching. Thank you. A special thank you to the Radio Kingston team, as well as Diane, Manuel, Roxanne, who used to help and we haven't seen in a little while, but thanks to her from the early days. Now that we've reached this milestone and as things continue to improve on COVID, we are going to shift to a once a week update. And then we'll also be doing other briefings and so on as needed. But until we get fully through this, we'll absolutely continue to do our COVID updates. And I just want to take a minute to kind of, I guess, celebrate the 100th. I don't know if it's quite celebrate is quite the right word, but at least to appreciate that we've done 100 of these. The normal numbers that we start with are total case numbers now cross just over 15,000 cumulatively, 373,000 plus tests with 14,609 recovered. And in the last week since our last update, we have had one additional fatality, unfortunately, to report, bringing us to 258. However, the fact that at least the rate of fatalities is slowing down, and to just see one in the last week is at least a significant improvement. But of course, we need to get that to zero, and I think we really are making progress in that direction. Hospitalization numbers are slowly trending down, but not as quickly as we'd like. 11 currently hospitalized in Ulster County beds, 2 of them in ICU beds. And again, a reminder of the seriousness of this and what is at stake, that we still have folks fighting for their lives in here and of course across the state and the country. So please continue to think of them, not just in sending them love and best wishes for recovery, but also in the decisions that we all make and the consequences of those decisions. The active case numbers are looking incredibly good, and you can see it starkly on this graph. We are at 136 cases, active cases, excuse me. That is the lowest that we've been on active cases since October 2nd of last year. So that is great news. And to me, the big takeaway here is crystal clear. It's that vaccines work. As we get more people vaccinated, the numbers are just dramatically dropping. This has been validated, of course, by all the public health experts and with a major announcement today by the CDC that I'll talk about in a minute. But right here in Ulster County, we're seeing that our vaccination efforts are working. As more and more are vaccinated, of course, the cases come down and the new infection rates come down. Looking at the new infection rate, in the last 48 hours, we have tested 2,521 residents and had just 32 new positive cases. So that puts us at a 1.27% new positivity rate over the 48-hour period. That's also getting pretty close to the low level that we had throughout the spring and summer of last year. So God willing, and if we all continue to do our parts here, we can get that number closer and closer to zero and hopefully maintain that until we get to the point of full herd immunity and get on the full path to recovery and reopening here. Hospital capacity, we continue to, of course, look at this, but have been in good shape here for many months and remain that way with more than sufficient near and medium term and long term capacity. In terms of safety protocols and precautions, there's a major announcement today on masks, which I'll talk about in a second. But we are not, even with all the progress, fully through this. So especially for those who have not yet been fully vaccinated, we do have to continue to wear masks, maintain distance, and wash hands. But the very good news and frankly huge news today, breaking from the CDC, is now the updated guidance that if any American is fully vaccinated, the CDC recommends that they can now go without masks and without distancing in almost every case, both indoors and outdoors, which really paves the way for a full reopening. The only two exceptions that the CDC has highlighted are airplanes, as well as specific healthcare settings, where obviously extra precautions are required. But again, what this means is that for the first time, there's a logical conclusion that vaccines work and therefore we don't need masks. And for those asking that question of why should I be vaccinated? Well, here is a very practical answer. If you want to no longer wear your mask, then get vaccinated. And the more people that do it, the more people you can be around without masks. And that will also, of course, speed our path to normalcy, reopening schools, reopening businesses, and getting out of this very dark and difficult last year plus. So that's great news from the CDC. I imagine that New York State will follow suit with formal official guidance. That has not happened yet, but I think that probably will in the next hours or days here. But we did want to share that as it was breaking from the CDC. So what does that mean for us here in terms of our path forward? What it really means is the faster we can get everyone vaccinated, the faster we can move forward and get out of this. So we are doing everything that we can to get Ulster County residents vaccinated, to make it as safe and easy and equitable as possible as we have from day one. And we really have tried, especially these last few weeks, to be creative as well in how we're doing that. So really exciting new program and partnership that I wanted to announce today. And we're actually the first county in New York State to do this. We're launching a partnership with Stewart's Shops, one of my favorite go-tos on my commute, where partnering with Stewart's will open for the first time walk-in vaccine clinics at Stewart's locations throughout Ulster County. And I really want to thank the leadership of Stewart's for partnering with us on this. You can see the dates for our first three of these. They'll start the very end of May going into early June. The other, of course, big upside here, in addition to getting vaccinated, which should be a reward in and of itself, but for those who might need a little extra reward, for the first 100 residents at each of these, at each site, they will get their choice of either free Stewart's ice cream or free Stewart's coffee. That is a hard choice, but I think I would go probably with the ice cream. But for those of you who wanna pick, you now have that option. Once again, I really want to thank the Stewart's leadership for partnering with us on this, as well as our team for coming up with this creative idea. And you can see those locations starting May 26th in Milton, June 3rd in Ellenville, and June 4th in Rosendale. And hopefully, if this goes well, we'll look to expand and continue it. So please spread the word about that. In addition to that, we'll continue all of our other vaccine efforts that we've been running, from our larger pods to our walk-in clinics. So for this week, Ulster County has been allocated a total of 2,240 vaccine doses. In terms of how we'll be distributing those, we'll continue to run our normal pod sites. In addition, our very successful walk-in clinics, will continue those as well. We have one this Sunday at St. Mary's Church in Kingston. You can see from 10 a.m. to 3 p.m. where Moderna vaccine will be available there. And then on Tuesday, May 18th, want to thank Christine Hine and the team at People's Place for partnering with us there. We're going to do another clinic there Tuesday from 8 a.m. to 1 p.m. And we'll actually have all three of the different vaccines available there. So we're continuing to do our walk-in clinics. In addition, in a continued effort to make this as easy and accessible as possible, we are also doing our first 2 school vaccination clinics starting this week. So Friday afternoon will be an evening at Rondout Valley High School with Pfizer vaccine, and then next Wednesday in Saugerties. This is, of course, enabled by another positive development earlier this week, the granting of the emergency use authorization for the Pfizer vaccine for 12 to 15-year-olds. So we anticipated that coming and sort of had these ready. So we're glad to see that emergency use authorization. And for those who want to be vaccinated or have their children 12 to 15 vaccinated, here are 2 options, and we're also talking with other school districts about replicating that if they'd like to partner with us on that. All these efforts, again, are all towards the overall goal of getting to herd immunity in Ulster County, and that will be measured by how much of our population have been vaccinated. We are making headway each day, but we really need to speed this up. We're continuing to lead the Mid-Hudson region, which is great, but that's not an excuse for us to relax. It's an excuse for us to, I think, push even harder. Here are updated numbers as of earlier today. 83,662 residents have received their first dose. Have completed their full series. 99,135 have gotten their first dose. We're getting really, really close to that 100,000 number. And you can see the percentages there. Very encouraging when you think about the fact that for adults 18 and up, we're now at over 2/3 of adults in Ulster County have at least received their first dose. So that is great, but we need to get that last 20, 30% done, and we need to get it done rapidly so, again, we can push through the rest of this last phase of the pandemic. We want to hear from you all and have community leaders and groups involved in more of our vaccine clinics and pods. So if you're hosting a community event, farmers market or other gathering or special community event, you can actually sign up on our website at vaccinateulster.com. Let us know that you're having that event, and we'd be happy, if you'd like, to come and actually host one of our mobile walk-in vaccine clinics. Just another way to try to make the vaccine readily available. Many of the folks that I've been talking to as I go visit our different clinics are not so much hesitant, as we've read a lot about in the press, but frankly, they're just kind of overwhelmed. And there's a lot going on right now. People are busy with lots of stresses and logistical challenges between work and kids and school and all the other pressures. And just kind of making everything work and keeping head above water. So a lot of it is really making it as convenient and easy and taking some of the anxiety and stress and complexity out of it. So that's really why we're working to make the vaccine available as many places as we can at as many times as we can. So please help us there if you're willing. All the information about our vaccination efforts and progress and clinics and frequently asked questions is all at vaccinateulster.com. So you can go there, and that's a great single point resource for everything. If you'd like to be a volunteer, continue to put out this call and also continue to thank all of our volunteers that have been stepping up. ulstercountyny.gov/volunteer. That's where you can go to sign up, and we are providing and continue to provide a stipend for all of our volunteers. So that was a lot, as I said, but all really good, encouraging news, and I hope really fuels our engines to push through this last bit. As we wrap up, I want to thank all of you. I'd like to thank all of our frontline workers. Yesterday, I stood with Sheriff Figueroa, as well as the head of our Fire Chiefs Association, Chief Hepner, as well as the head of our EMS and first responder group, and we all unified said, look, it's a public health issue, but it's also a public safety issue that everyone be vaccinated. For those law enforcement professionals and first responders that have been out there risking their lives and continue to do that, everybody being vaccinated makes them safer. It makes our whole community safer. And I'd really like to especially thank our law enforcement professionals, our corrections officers, our first responders who have been doing their work along with all of our other frontline workers at great risk throughout this entire pandemic. We continue to thank and appreciate your work there. That is it for the update for today. Any needs or questions that you have, if you'd prefer to give us a call, you can call our Recovery Service Center or go online. The number is 845-443-8888. That is the single best place to call with questions and if you need help. That's it for today's update. Again, thank you for all of the work. Thank you for everybody rising as a community to meet the challenge. I know it's been hard. I know we've asked so much of everybody, but we are so darn close to getting through this. Let's all just pull together and get over the line here as quickly as we possibly can. I'm excited about the rest of the spring and the summer, and I'm excited that we're almost to that point of full reopening and recovery. Our next update will be a week from today. We'll be doing them on Thursdays, so I'll see you in a week. In the meantime, we'll be sharing our numbers. You can check our dashboard and always reach out if you have any questions or needs. Until then, stay safe and healthy. Have a great weekend and stay resilient as we get through the end of this pandemic. Take care.